My name is Francisco Rojas. I am obstetrician and gynecologist. I work for Hopkins Community Physicians at Baltimore and in Howard County. Then a pregnant patient needs to come every 4 weeks during the first 28 weeks, every couple of weeks between 28 and 36 weeks, and every week after 36 weeks until she delivers. And the reason is because things change much faster and dramatically during the last couple of trimesters. Keep in mind, a normal pregnancy lasts 40 weeks, that is around 280 days. Congratulations, you are pregnant, and the first thing that we want to do to protect your baby is start prenatal vitamins. They are different to the regular multivitamins that you can get in the market because they have less vitamins and minerals and in less concentration than the regular products that you normally get for non-pregnant patients. The purpose of the vitamins is give you all the minerals and vitamins that you need without to overwhelm the baby and potentially obtain side effects. The majority of prenatal vitamins will bring iron, and it's important to add polyunsaturated fatty acids that we call commonly DHA because they help to develop the baby's body. During the pregnancy, there are very interesting landmarks of development. For example, in general, we are able to see our baby with an ultrasound machine around 6.5 or 7 weeks. Sometimes earlier, sometimes later, but that's more or less time when we can expect to see the baby. Then, if for any reason you have an ultrasound done earlier, don't be surprised and don't be concerned if they were not able to identify the embryos. Around 10 weeks, we will be able to listen to the baby with one of our manual Dopplers, those small amplifiers that we put in our pockets during the regular visit. 12 weeks is a very interesting time because the baby is listening for the first time. That's when we recommend all of our fathers to come and talk close to the mother because the baby gets familiar with the kind of voice and tone, and the baby will be able to identify that voice later after the delivery when the baby is really concerned, is really confused, there are too many changes, and the baby will be probably reassured and calm when listening to the father's voice again. We like to perform many tests during the early pregnancy because it helps us to identify things that needs to be changed and we can protect better the baby and the mother. There are tests that will be done in blood. For example, for infection diseases, we check for hepatitis, we check for rubella, we check for syphilis, HIV, among others. But also we want to take some urine samples because we want to look for medications that could be potentially toxic for the babies or urinary tract infections that can produce rupture of membranes or preterm labor. Additionally, some patients could need to have a pap smear done if it was not performed during the last 3 years or so. I would add that the blood sample is important also to check for the blood level, the type of blood, to be sure that the differences between the mother and the father are not potentially dangerous for the baby. And also we check for antibodies from the immune system that can potentially cross the placenta and interfere with the pregnancy. Between 11 and 13 weeks, we encourage all of our patients to take a first trimester genetic screening. This test was developed to try to identify babies that could have abnormalities with their chromosomes and also pregnancies that could be more prone to develop preeclampsia, growth restriction, preterm labor, and even fetal demise later during the pregnancy. The sample is obtained with few drops of blood from your finger and an ultrasound that normally we perform around 12 weeks of pregnancy. Fortunately, the majority of babies will be completely normal. However, if you have abnormal results with your screening, it does not mean that you have a baby with those abnormalities, but suggests that you should do more testing to try to confirm or rule out the possibility of something abnormal.